patient or an external beam radiation patient always knew someone else. And when I found that other person, I could find two more. So I interviewed literally hundreds of patients that represented each of the major treatment modalities. And I must say, and I write about this in my book, that's where my education began. That's where I learned most about the treatment options. And that's what helped me most in making my own treatment decision.
All right. Before we continue on with your journey, there is a question I have to ask you, just based on the process of your research. Has your faith or trust in the medical community been challenged, given that going through this process, you had a number of doctors who are supposed to be experts in their field, who are supposed to be giving you the best information with your best interests in mind? Do you have a hard time trusting doctors now? Because in listening to your story, I'm less likely to trust a doctor right now, and I'd rather go talk to the patients for anything I ever get diagnosed.
That's a great question, Frank. And I think the answer that I would give you is that I look upon doctors differently today than I did in the past. I wouldn't say that I don't trust them, but what I've learned is I grew up believing that, doctors were the closest thing to God, that once somebody achieved that level in their profession, that they had all the answers and they knew what was best for me as a patient. And I learned that that's not the case. What I've learned is that doctors are human beings, as I am. They have faults as I do. They make mistakes as I do. And I learned that doctors in certain professions who have specialties tend to be somewhat myopic about their profession and their specialty. And I think many of them, if not most of them, honestly believe that if they are surgeons, then what they have to offer is in the best interest of their patients. Well, there happen to be radiation oncologists who deliver radiation to destroy cancers, and they tend to believe that their treatment is the best for their patients, and so on. And what I learned from that experience is that the doctor doesn't necessarily know what's best for you. And if you're going to make an informed decision, you make that decision on the basis of all of the data that you take in. And that data includes information you get from books, information you get from the internet, information you get from doctors, and information you get from speaking with former patients. So, yes, I do look upon doctors differently than in the past. I believe most of them are acting in my best interest, but I don't believe that any one of them can make the decision for me. I think it's up to me to make that decision.
And with that answer, we're going to go to our first commercial break. You're listening to Frank Talks Pleasures and Lifestyles. We'll be back right after this.
Frank Talks is sponsored in part by the program Dating Younger Women, a guide for older men to the emotional needs of loving younger women. Frank brings good news to the older seducer. To women, they possess higher value. Frank's lecture reviews the stigmas associated with older men dating younger women and their solutions. Key emotional needs for both women and men in the age difference, methods of approaching younger women, and several answers to questions posed by older members of the audience. He also very much covered marriage between an older man and a younger woman. When dealing with a little girl inside, a man must be able to distinguish those women who wish to compensate losses in a father figure from those who are seeking and capable of an authentic relationship. Frank adds advice on where you can meet younger women, as well as dealing with the competition. Life gets better. All in all, a confidence-refreshing lecture for men concerned about their erotic viability over the hill. Dating Younger Women, a guide for older men to the emotional needs of loving younger women. Buy this program now at franktalks.com.
Frank Talks is sponsored in part by Everything Out of Her Mouth is a Test, a man's guide to the emotional needs of women. What would your life be like if you knew exactly what to say and do with women? Learn how to handle women's tests by addressing her emotional needs. By this, you create the type of attraction that will make her see you as the one. This book is a guide for men to understand exactly what a woman means when she speaks. Is that worth changing your life forever? Buy this book at franktalks.com now.
Frank Talks is making the world a better place by interviewing people on pleasures and lifestyles in order to inspire and educate listeners like you about the possibilities to lead more interesting and fulfilling lives. Be sure to visit our website at www.franktalks.com for the most up-to-date information and the latest downloads of programs just like the one you are listening to now.
You're listening to Frank Talks Pleasures and Lifestyles. I'm Frank because I have to be. Today we're talking with Robert Marckini. He is the author of the book You Can Beat Prostate Cancer. And in the last segment we talked about what prostate cancer was, part of Robert's personal journey. And we're going to continue on with some more very serious questions about cancer. Bob, let's look at the different options for someone who has prostate cancer. You've mentioned surgery before, and the surgeon says that surgery is the best, and you mentioned a few other options. What can you tell me?
Well, there are perhaps three major categories for treating prostate cancer, and within each of those categories, there are multiple subcategories. Three major treatment categories are surgery, radiation, and cryoablation. Surgery has to do with removing it. Radiation has to do with destroying it with radio waves or with subatomic particles accelerated to the speed of light. And then the third is cryoablation, which is freezing it. Within those categories, surgery is basically removing it from your body, but you can have that done with open surgery, you can have it done with laparoscopic surgery, you can have that done with robotic laparoscopic surgery. I'm not a fan of surgery of any kind because it's extremely invasive, it's a very complex procedure, and it doesn't cure cancer any better than the other alternatives. And it generally leaves the man with a much poorer quality of life after treatment, especially in the area of impotence and incontinence. With radiation, there's external beam radiation and there's internal radiation. And there are many forms of external beam, which includes conventional X-ray radiation and then advanced forms of X-ray radiation. And one of those is proton beam radiation therapy, and we can talk about that separately. And then there's internal radiation, which is the implantation of radioactive seeds within the prostate. And there are pros and cons to that, and there are quality of life issues connected with all forms of radiation. And then, of course, the third category is liquid nitrogen, freezing the cancer. That generally tends to be a procedure that is relatively new, and it's used more nowadays as a salvage treatment as opposed to a primary treatment. And then in addition to that, there's hormonal therapy, which is generally used as a follow-up for more advanced cancers, and high-intensity focused ultrasound. And another common approach to treating prostate cancer is something called watchful waiting or active surveillance. And then there's chemotherapy and so on. So as you can see, if you're newly diagnosed and you're doing your research and you come across all these major categories and then all these subcategories, making that decision is very difficult. And it's one of the reasons why some people just say, "Doc, tell me what to do." And that's probably the worst thing you could do.